38-year-old woman with no previous symptoms or history presents with deep vein thrombosis. How did she get it?
Oral contraceptives, smoking, diabetes, obesity, and what's the point here? A DVT is a DVT. Put on IV heparin to prevent future clots. What's the big mystery?
She's 38 years old. She's 20 years too young for a DVT.
I treated a 12-year-old girl once, soccer player. She got kicked in the leg.
There was no trauma, none of the other risk factors.
You took a history?
I have some notes. They're not mine, but I think that they'll prove useful for the purpose of this discussion. As for the immobility, she's pretty active right now. Paranoia does keep her limber.
Paranoia?
Yeah, she's schizophrenic. Her kid wrote these. Might be a little biased. Do you think there's a connection? Do we include schizophrenia in the differential for the DVT?
Well, the answer is no. Abnormal dopaminergic pathways in the brain do not cause blood clots. Schizophrenia is not the cause of a DVT.
On the other hand, we don't know very much about schizophrenia. Maybe there is a connection.
Well, schizophrenia explains one mystery. Why you're so fascinated by a woman with a bump in her leg.
I'm only interested in the DVT. She's 38 years old, right? She should be...
Great, solve this one and you're on your way to Stockholm.
We don't even know how to treat schizophrenia. Come on, fumigation of the vagina?
A little louder, I don't think everyone heard you.
2,000 years ago, that's how Galen treated schizophrenics. The modern Marcus Welby of ancient Greece.
Well, clearly you're not interested.
I'm interested, all right. I'm interested in how voices in the head could be caused by the malposition of the uterus.
Like there's a better place for it?
And now what do we have? Lobotomies, electroshock, rubber rooms. My, Galen was primitive.
Where are you going?
To go see the patient. That all-important human connection, I thought I'd give it a whirl.
You won't talk to patients because they lie, but give you a patient with no concept of reality.
You think I'm only interested because of the schizophrenia?
I'm pretty sure.
Well, this is a pretty complicated case. Think of the implications it could have if we made a breakthrough.
There you go again, trying to be a hero.
Yeah, well, I have to start somewhere.